On today's Two on Your Side Town Hall, hospital strain. Local hospitals are nearing capacity, but how much of that is from COVID? We are looking into that today.
Plus, the new stadium for the Bills. While we wait to hear from the team and the state and county leaders on where it will be built, we do have an update from a federal lawmaker in Buffalo. We'll discuss that.
And we are going to introduce you to something called biometeorology and show you how your body really can change with the weather.
We're glad you're here with us, everybody. Thanks for joining us. We want to start here with maybe the most important number that we've been following over the last 20 months or so, hospitalizations in our region.
If hospitals get full, everyone feels the impact, even those who aren't dealing with COVID. So here is where we stand in Western New York, according to the latest numbers from the state. 484 people in the hospital yesterday with COVID, the most since the middle of January.
And you can see that number has skyrocketed. 3 weeks ago, it was at 280. And we've heard the refrain from local leaders for a while now that these hospitals are really being strained by this latest spike. So that's the big picture, but what are individual hospitals saying about this?
Two on Your Side, Steve Brown has been calling around to get more information on that today. What'd you learn, Steve?
Well, Kate and Michael, based on my conversations with a number of area hospital officials, it's safe to say that they're pretty concerned about the soaring numbers of new COVID cases in Erie County and generally within the region. And with more COVID cases, there often comes an increase in the number of people in the hospital with COVID. So let's have a look at some recent data. 5 area hospitals, all with COVID patients. With the exception of Millard Fillmore Suburban, those COVID patients make up a relatively small percentage of the hospital's patient population. But area hospitals are also close to full and are preparing as best they can for an increase in admission because of an anticipated increase in COVID patients.
Our hospitals cannot take a doubling of our COVID admissions right now. You know, we are already strained, and we need the public to help us out to help limit the number of COVID admissions over the next couple of months.
And what Dr. Cloud urges is the same thing public health officials are stressing right now. Get vaccinated. Get the booster if you're eligible. Wear a mask in public places. Because to take some liberties with a seasonal phrase, there's precious little room at the inn right now. Michael and Kate?
Steve, a big question is whether or not vaccination mandates for healthcare workers is causing there to be fewer hospital beds available right now. Do we know if there is any truth to that at this point?
There's at least some. Because of failed court challenges, the religious exemption ends on December 4th. That's Saturday. Dr. Cloud says there are 150 staffers in that category at ECMC. There is some hope some of them will get vaccinated, but if they do not, they'll end up losing their job, and that impacts available beds. In anticipation of this, ECMC has also brought in agency staff, medical temps, if you like, just like Mercy Hospital did during the recent strike. So it's a bit of a scramble, not just for ECMC, but for every hospital looking for staff. Hard to find.
We also know, Steve, that there's an issue of patients sort of being parked in hospitals because of a shortage of nursing home beds. Do we know how big of an issue that is right now?
That's very significant, says Dr. Cloud. Tonight, there would be 47 available beds at ECMC if they could transfer those patients to either a rehabilitation facility or a nursing home. But those facilities have the same problem hospitals have. They are short-staffed, beds have been reduced, so patients who really should not be in the hospital have to stay in the hospital. It's kind of a domino effect.
Yeah, no doubt about that. Great information there. Steve Brown reporting for us. Steve, thank you.